Hi, and welcome to the 9Health Privacy and Security Training. This is part of our 2019 HIPAA compliance effort, and we will be teaching you about the security and privacy requirements associated with working with or for 9Health. Please feel free to stop this presentation at any point if there's anything on the slides that you would like to review in more detail or take notes on. There will be a test at the end of this video, which you are required to pass, and there will be an acknowledgement in which you must also sign off on to acknowledge that you have completed the training and understand your responsibilities in protecting our participants' privacy and personal information. HIPAA, the Health Insurance Portability and Accountability Act of 1996, was passed effectively as a law requiring additional laws. There are subsequent rules that are associated with HIPAA, and we will cover each one of those in the course of this training. These rules all apply to HIPAA covered entities, which are defined as health plans, healthcare clearinghouses, healthcare providers, and all of the business associates who work with these health plans, payers, or providers. While 9Health is not directly a HIPAA covered entity in this definition, we are not directly involved in the treatment, and we in fact try to avoid being directly involved in the treatment. We only provide education and act as a payer advocate. Nevertheless, we are actually a business associate of Dr. Parsons, who is a provider, and we use Dr. Parsons' NPI, or National Provider ID, to order the blood tests that are done at 9Health fairs. Nevertheless, we do not get involved in treatment, payment, or operations. And while we are technically, therefore, not a HIPAA-covered entity, we have chosen to act as a HIPAA-covered entity for some very specific reasons. First and foremost, it instills confidence in all of our participants and other constituents with respect to the handling of their PII and PHI. This means that they know that in dealing with us, we are treating ourselves with the same level of integrity that is required of any other HIPAA-covered entity, and their information is safe with us. As well, this training and our stance as a HIPAA-covered entity ensures that all 9Health staff and partners and volunteers understand and sign off on their role in protecting participant PHI. Unfortunately, this decision does require that everyone must go through this training and must sign off on the awareness of their obligations herein. Introducing HIPAA privacy and security rules. The HIPAA rules dictate that personally identifiable information, or PII, is to be considered as PHI in the context of healthcare treatment. It means that any of this information, paper or electronic, must be secured and protected. All 9Health staff who come into contact with PHI or PHI must go through this training and must sign off on their awareness of their responsibilities according to the HIPAA rules. This training will be documented, and the record of your acknowledgement will be maintained by our HR department. The primary purpose of the HIPAA regulations were threefold. First, to protect people from losing their health insurance if they change jobs or have pre-existing conditions. This is the portability of the HIPAA Portability and Accountability Act. In practice, this has not been implemented to the extent that the original law desired, because we're in a capitalistic society and every payer is different. You can't just move one plan from one payer to another payer. However, there have been subsequent laws that have been passed to ensure that pre-existing conditions and health insurance is not portable at the plan level, but portable at the coverage level as you move from job to job. HIPAA was also designed to reduce costs and the administrative burdens in healthcare by creating standard electronic transactions. This rule was called transactions and code sets. We will talk a little bit more about that later. Finally, HIPAA intended to develop standards and requirements to protect the privacy and security of personally identifiable health information. This is covered in both the HIPAA privacy rule and the security rule. This material will train you on the basic rules regarding the use, transmission, security, and privacy of healthcare data. We are now going to watch a short video that will introduce these basic concepts, and afterwards we will talk specifically about what they mean to those of us here at 9Health.
The HIPAA privacy and security rules dictate that all who may come in contact with protected health information go through a training on HIPAA policy, and that there be documentation to prove that the training has been completed. This program will train you in the basic HIPAA rules regarding the use, transmission, security, and privacy of healthcare data. In August of 1996, Congress enacted the Health Insurance Portability and Accountability Act, also known as HIPAA. The primary purposes of HIPAA are to protect people from losing their health insurance if they change jobs or have pre-existing health conditions, to reduce the cost and administrative burdens of health care by creating standard electronic formats for many administrative transactions that are currently carried out on paper, and to develop standards and requirements to protect the privacy and security of personal health information. It is these privacy and security standards that this program will discuss in more detail. Upon passage of the HIPAA Act, the Department of Health and Human Services was required to issue two separate regulations referred to as the Privacy Rule and the Security Rule. These regulations require healthcare organizations to adopt processes and procedures to ensure the highest degree of patient confidentiality. These processes include administrative, physical, and technical safeguards to ensure that medical information is stored, transmitted, and received in a safe and secure manner. HIPAA regulations cover a broad scope and impact virtually every department of every entity that has access to personal health information. Hospitals, medical practices, insurance companies, and other healthcare organizations are undergoing significant changes in the way they handle patient information. When covered entities use or transmit protected health information in any form, they must comply not only with the privacy and security rules, but also with any state laws regarding privacy of medical records. In the event of a conflict between HIPAA and state law, HIPAA preempts state law unless the state law is stricter. In other words, whichever provides greater protection to patients must be followed. Entities covered by the privacy and security rule include healthcare plans, healthcare providers, healthcare clearinghouses, and business associates of covered entities, which include auditors, consultants, lawyers, data and billing firms, and others with whom the covered entities have agreements involving the use of protected health information. The privacy and security rules protect individually identifiable health information transmitted or maintained by a covered entity, no matter what form it takes. That means that when a doctor takes notes in a medical chart, when a hospital data entry clerk types health insurance information into a computer, or when healthcare providers discuss a patient's condition, any identifiable health information becomes protected health information under HIPAA. A covered entity may not use or disclose protected health information except as the individual authorizes in writing or as the HIPAA privacy rule permits or requires. The HIPAA privacy rule allows the use and disclosure of protected health information without an individual's authorization for the following purposes or situations: to the individual or their authorized representative, for treatment, payment, or healthcare operations, when the individual has the opportunity to agree or object, such as when the patient brings another person into the exam room for their office visit, incidental to an otherwise permitted use, and for the purpose of research or public health. Covered entities should also rely on professional ethics and best judgments in deciding which of these permissive uses and disclosures to make. The privacy rule requires a covered entity to provide patients with a Notice of Privacy Practices, or NPP, and make a good faith effort to obtain a patient's written acknowledgement of receiving the NPP. The Notice of Privacy Practices must inform patients of the uses and disclosures of PHI that the entity may make, the patient's right to access and amend their medical information, and the covered entity's responsibilities with respect to PHI. Once it has obtained the acknowledgement or has made a good faith effort to do so, the entity may use PHI for its own treatment, payment, or healthcare operations, and disclose PHI to other covered entities for their treatment, payment, or certain limited healthcare operations. When using or disclosing PHI, or when requesting PHI from another covered entity, a covered entity must make reasonable efforts to limit PHI to the minimum necessary to accomplish the intended purpose of the use or disclosure. Except in certain circumstances, individuals have the right to review and obtain a copy of their protected health information. Covered entities may impose reasonable cost-based fees for the cost of copying and postage for information requests. Also, personal representatives, parents of minors, and others may be legally authorized to make healthcare decisions on behalf of patients. These individuals should be treated with the same information access as the individual. As a general rule, a covered entity may not use or disclose protected health information for purpose other than treatment, payment, and healthcare operations without the patient's written authorization. For example, the privacy rule prohibits a covered entity from disclosing PHI to others for marketing purposes without the patient's written authorization. At the same time, communications regarding treatment, case management, or the recommending of alternative therapies is excluded from the definition of marketing, as are communications that promote health in a general manner. Thus, for example, a health-related newsletter that a covered entity distributes to patients to inform them about new healthcare developments would not be considered marketing under the privacy rule. The privacy rule also allows incidental disclosures of PHI as long as the covered entity uses reasonable safeguards and adheres to minimum necessary standards. For example, doctors' offices may use waiting room sign-in sheets. Hospitals may keep charts at bedsides. Doctors may talk to patients in semi-private rooms, and medical staff may confer at the nurse's station without violating the privacy rule, as long as reasonable safeguards are followed. Since many employees receive, store, and transmit PHI as part of their day-to-day responsibilities, the privacy rule requires the following administrative safeguards to ensure that PHI is not compromised. A privacy officer, designating a privacy officer to be responsible for the development and implementation of privacy policies and the receiving of complaints. Training. The training of all workforce members on privacy policies and procedures as necessary and appropriate for them to carry out their job functions. Business associates, requiring business associates such as lawyers, consultants, auditors, billing companies, and pharmacists to confirm that they will protect PHI. Tracking, developing a system to track who accessed what information, and violations, implementing rules for addressing violations of privacy, security, and transaction regulations, including establishing a process for making complaints and preventing retaliation against anyone who reports a HIPAA violation. The security rule portion of HIPAA also requires that administrative, physical, and technical safeguards be in place to prevent the improper use or disclosure of PHI. These safeguards primarily deal with the security and transmission of data that contains PHI. These requirements include a security officer, designating a security officer to be responsible for the development, implementation, and evaluations of security policies. This may be the same person as the privacy officer. Risk analysis, a technical evaluation and implementation of procedures to ensure that computers are secure from intrusion. Risk management, implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level to comply with HIPAA requirements. A sanction policy, applying appropriate sanctions against employees who fail to comply with HIPAA policies and procedures. Information System Activity Review. Implement procedures to regularly review records of information system activity, such as audit logs, access reports, and security incident tracking reports. Employee security. Develop a plan for granting and limiting different levels of access to PHI, including clearance procedures and termination procedures. This includes security checks and special training for all employees with access to sensitive information. It's important that all employees understand how to keep PHI secure and report any incidents regarding PHI. Employees should also understand the importance of password security, computer virus protection, and the dangers of malicious software. Your trainer should review the internal policies regarding each of these important security issues. Business Associate Agreements. Agreements with external recipients of PHI confirming that they will protect the confidentiality of data exchanged. A contingency plan. A plan for responding to system emergencies, including the performance of backups, emergency mode operations, and disaster recovery procedures. And security incident procedures. Instructions for reporting and dealing with security breaches. And physical safeguards. The security rule also requires a number of physical steps to ensure that PHI contained in computers is properly protected from environmental hazards, as well as from unauthorized intrusion. Physical safeguards include the following: facility access controls. Develop a facility security plan that deters intruders from accessing environments where sensitive information resides. Guidelines on workstation use and security. Procedures describing the proper functions to be performed on computers and how to handle sensitive information that may be displayed on computer screens. And media controls. A set of procedures that govern the receipt and removal of hardware and software such as disks, memory sticks, laptops, and PDAs, as well as procedures for off-site data backup. Finally, the security rule requires certain technical safeguards for PHI, including access controls. Controls to ensure that access to sensitive information is available on a need-to-know basis, based on user responsibilities. Audit controls. Controls to record and examine system activity, helping eliminate unnecessary access to sensitive information. Data authentication. Controls to help ensure that health data has not been altered in an unauthorized manner. Person or entity authentication. Controls to ensure that data is sent to the intended recipient and received by the intended party. These controls include the use of password protections, PIN numbers, and when sent over public networks, encryption, and transmission security. Sending PHI via email and fax. According to the security rule, it is permissible to use the internet to transmit PHI as long as an acceptable method of encryption is used to protect the confidentiality, and appropriate authentication procedures are followed to ensure correct identification of the sender and receiver. Although faxes are transmitted over telephone lines, they are not considered to be covered transactions by the security rule. However, they may be sent as authorized by your company's privacy policy. The HIPAA regulations are now completely in effect, and failure to comply with the HIPAA privacy and security rules can lead to significant financial and other penalties. Civil and criminal penalties to both individuals and companies may be enforced and include fines of up to $1.5 million per year and 10 years of imprisonment. It is important that all who may come in contact with PHI understand and carry out their responsibilities under these rules, as outlined in this training program.
Welcome back to the 9 Health Fair HIPAA Security and Privacy Training. This slide shows you an overview of the actual HIPAA regulations, the various titles, and the rules. You can pause again and view this at your leisure. We'll highlight here the transactions and code sets, which was done to try to create administrative standards and reduce cost. The privacy and security, which is what we're focused on talking about here today. And there was an effort to create national identifiers, starting first with the National Provider ID, or NPI. As mentioned before, Dr. Parsons is the doctor whose NPI we use in order to order lab results currently through Quest. There is also a plan for a national payer ID, which is currently in the works but not yet passed into law. Overview of the HIPAA Act. As mentioned, the HIPAA Act was passed in 1996 primarily as a law requiring a law. The Clinton administration campaigned on a platform of healthcare reform, but realized in the doing that it was far more complicated than they could tackle even in one presidential term. The law requiring a law created a series of follow-on rules over the years, starting first and foremost with the privacy rule, which tells us what must be protected, and following with the security rule that explains how to protect it. The rules are broken down into what are commonly called safeguards. There are administrative safeguards, physical safeguards, and technical safeguards. They actually have 5 categories if you look in the detailed regulations, but they still really fall into all of these categories. These safeguards are all intended to assure that PHI is secured whenever received, stored, or transmitted. 9Health impacts nearly HIPAA impacts nearly every 9Health department who touches patient data in any area, because you might be accessing, viewing, maintaining, storing, transmitting, or receiving patient information. Compliance isn't just for the rules, but there are also state laws that we must comply with regarding these as well, not to mention additional regulations associated with the Administrative Care Act, or ACA, Obamacare, and a number of other presidential executive orders related to security and electronic processing. We'll start with the privacy rule. A covered entity must first and foremost not use or disclose except as an individual authorizes the entity to use or disclose their personal information. We must provide a notice of privacy practices, or NPP, and make a good faith effort to obtain a patient's written acknowledgement that they have received a copy of our NPP. This is available in writing at fairs as well as available on our website. We must make reasonable efforts to limit the PHI that we use or share for its intended purpose, so that we are doing what is called minimum necessary function. This also means that individuals who have access to PHI should only have access to the PHI necessary to do their job function. We are not to disclose PHI to anybody else for the purposes of marketing without written authorization from the participant. We also secure this authorization electronically on our website for those participants who register electronically. Regarding communications associated with treatment, case management, or promotion of information, including recommendation of alternative therapies, that information is excluded, and we are authorized to use PHI in order to keep our participants informed. And the final requirement of the privacy rule is that every organization must establish a privacy officer. The security rule is a little more complicated. As said before, it's not just about what must be protected, but how. First and foremost, the rule requires that you must develop and establish security policies for the storage, maintenance, and transmission of personally identifiable health information. We must annually perform a risk analysis to make sure that we are protecting all of this information through our procedures and practices related to computers and electronic storage of information. We must protect it from intrusion, and we must attempt to detect intrusion if such occurs. We must perform risk management, which means basically taking the results of this risk analysis anything that we identify on a regular basis as a risk, and we must manage those risks. This process is currently maintained by the IT department as part of our HIPAA compliance. Next, we must establish a sanction policy for anybody who fails to comply with these HIPAA policies. So HIPAA mandates, number one, not just that we train you, but that if there is a violation of the training, that we must have rules and guidelines for how to discipline employees who violate our policies, up to and including termination. It also requires that we must perform regular system activity reviews. This means having, maintaining, and reviewing audit logs, access reports, and security incident tracking reports. We must establish and maintain a workforce security plan, which means that we must identify the types and levels of access required by different job functions and manage that each job function has exactly what it needs and nothing more for people in that role to be able to perform their jobs. HIPAA requires that we must establish a business associate agreement, or BAA, with anyone with whom 9Health may disclose or share PHI. Business associate agreements are extensively spelled out in how and what they must cover in the context of the regulations. Most importantly, that the associate must similarly have policies and procedures to follow and protect PHI, that they must establish a chain of trust with anybody else they might do business with, that they must notify us in the event of a breach, and that we have the right to terminate the BAA at any time, and they must return any PHI shared. Next, HIPAA requires that we share a contingency plan to respond to emergencies, and the IT department has established both business continuity and disaster recovery plans. We must establish incident procedures to establish what to do and how to do things in the event of a security breach. We must establish physical safeguards for our computers, networks, computer rooms, all physical assets which might contain or store PHI, even filing cabinets. We must protect all of these storage mediums from environmental hazards as well as any unauthorized access. We must establish technical safeguards, which means that at a computer technology level, we have to have controls on who can access data, where they access it, and that we keep a record of their access in logs. And finally, security requires that we designate a security officer. So, in the context of this, we have established a risk management framework, which is the overarching security framework that defines how we meet all of those assessment and risk management standards. 9Health has chosen to apply National Institute of Technology standards for the way that we manage our framework. This framework also requires that we have training materials, including this Visio, the PowerPoint that you're watching as we go through this, the overarching framework, the quiz that you will be taking at the end of this, and the form that you will sign acknowledging that you have taken all of this and that you understand your responsibilities. It also requires the Notice of Privacy Practices, or NPP, which we must make available to participants both in paper and online electronically. And as discussed, we have to have a business associate agreement form that meets all of the required characteristics of a HIPAA compliant BAA. As previously discussed, you must designate a privacy and security officer. Our risk framework has also dictated that we have an executive risk officer. The executive risk officer is responsible for the overall organizational risk management framework and program, and make sure that we have assigned privacy and security officers. Our Chief Operations Officer, Adele Work, is our designated risk executive officer. As mentioned before, HIPAA requires privacy and security officers. Privacy officer owns responsibility for 9Health and all of our business associates' adherence to the privacy rule, including completing training, managing documentation, signing forms, overviewing audits, and managing complaints associated with any HIPAA compliance. Our designated privacy officer is Director of Health and Wellness, Stacy Brake. We must also designate a security officer who is responsible for all aspects of the IT and physical, administrative, and technology-related mismanagement framework, including, again, training, documentation, audits, reviews, tests, and management of BAAs and partnerships with our vendors. Our designated security officer is IT Director Dane Linder. Note that the privacy and security officer could be the same person, but in our case here at 9Health, they are different. Best practices, physical safeguards. As mentioned before, there are physical, administrative, and technical. Let's talk first about the physical. Simple things. Never leave papers laying around containing PHI or sensitive information. We don't want stuff left out in view for others who may not have a job role or responsibility to see PHI could access it. When PHI is not in use, it should be locked up in a secure location like file cabinets or folders or in your desk so that it is not accessible to other members of the organization who may not have authorization. Similarly, do not leave printouts laying around on the printer. If you print something with sensitive information, make sure to go get it immediately. Some members of the organization who print things fairly often will be given printers and already have printers in their offices to minimize this risk. If you are given a laptop to carry between work and home, be careful not to leave it around or visible where it could be stolen. Leaving things unattended, like laying out in plain sight in your car while it's parked at the bar downtown, is not a wise thing to do. Please take special precautions to protect the mediums like laptops or any other media that we give you that might contain PHI. We will also be working on measures to actually secure all PHI, even on these mediums, with encryption in weeks, months, and years to come. Always make sure that building doors physically are closed behind you whenever you leave, and that when the last person leaves at the end of the night, we turn on the alarm system and the first person turns it off in the morning. Last person, of course, should make sure that the building is empty before turning on the alarm. Similarly, strangers should not be walking around unescorted in the building. Never hesitate to greet and meet someone that you don't know to make sure that we do not have people wandering the halls who are not authorized to be here. And that kind of summarizes our physical efforts. Let's talk about technical. Never open an email attachment unless it is a file and file type that you were expecting from someone you know and trust. This especially goes for anybody sending you something from outside the organization, but it's even possible that somebody could send you something and it could be a phishing or malware attempt, spoofing as though it's another member of 9Health. So always watch very closely what you're getting, and if you have any doubt what's being sent to you, it was not something you expected, something that you knew you were going to be getting from that person or had already requested, please be very careful not to open attachments, especially anything that might be an executable. Things like PDF files are the safest way to share information. Excel files, Word documents are acceptable but higher risk. Anything other than that, be very careful that you know where it's come from and who is sending it to you. There has been an uptick in recent years of social malware attacks or phishing emails. Organizations like 9Health who carry PHI and work with PHI are at very high risk. PHI is one of the most valuable types of data to be stolen in the marketplace, way more so than a social security number or a bank account number, because if I do that, I only have access to your bank account. If I can actually get your personal health information and forge claims with your hospital or provider and get the insurance company to pay, we can easily get into hundreds of thousands of dollars which is usually way more than people have in terms of credit on their credit cards or money in their bank accounts. That's why health information is of so much greater value and we are at such high risk. Anytime you see something that is suspicious, please report it to the security officer. Again, that is Dane Linder, IT Director. Whenever you are setting a password in order to ensure the protection of your information and the information that your user account has access to, please remember to use a mix of numbers, uppercase and lowercase letters, and even a few special characters. This may sound difficult to do with a password that you could easily remember, but it's simple to do if you create simple phrases like, "How are you today?" This could be a capital H, lowercase OW, capital R, digit 2, DAY, question mark. That has upper, lower digits and a question mark. You can come up with all kinds of ways to create a memorable phrase that meets all of these requirements. You should also change your password regularly, at least every few months. One of the ways to do that might be to add a number for the month or a few letters reminding you of the month that you last changed your password. How are you today? Question mark 11 might be used if you changed your password most recently in November. Never ever write down a password on paper or even in an electronic file. If you must use electronic storage, there are apps and tools available for storing passwords in a secure encrypted fashion. Similarly, never share your password with anyone. No IT administrator will ever contact you and say, "I need your password." They all have administrative rights and they are all quite capable of accessing or viewing anything that you might need them to look at on your behalf without knowing your password. Moreover, when they reset your password, it should be done by sending you an email and a link that will allow you to privately reset your password yourself with nobody looking over your shoulder and no awareness of what you choose as your password. Okay, talking about more technical. Always lock your computer when you need to leave. This goes even for going to lunch, taking a break, or even just going to the restroom. Never hesitate to close to lock your laptop or use Control-Alt-Delete and Enter to establish the screen lock. Similarly, never send PHI to anyone else via standard email. If you need to send PHI via email, please talk to the security officer, Dane Linder. We may have tools that will allow you to send PHI in a secure fashion. If you need to share files or data containing PHI internally, upload the files to a secure location like SharePoint or Teams, and then let the person you're sharing it with know where the file is at. This is always better than physically sending the file via email. As I said, if you must send PHI, we do have email encryption. Also, please avoid installing any special tools or software on your computer without approval from the IT director telling you that it's safe to do so. In this way, we will minimize the risk of unexpected malware being installed locally. Always be vigilant about the importance of password security, computer viruses, phishing attacks, and malicious software. Finally, moving on to administrative. Know your risk executive, your security officer, and privacy officer, and who's doing what. Get and stay trained on HIPAA regulations and 9Health specific policies so that you can help us maintain our HIPAA compliance standard. Know how these affect your everyday work, signing off annually on your HIPAA training, and reporting any irregularities you become aware of. Be aware of the best practices promoted by these officers and participate in our annual training to stay informed and help 9Health protect our participants, their data, and our brand. So, this completes the training. Please take the test. You need to pass with an 80% or better form. Please sign and complete the acknowledgement form. Remember that there can be sanctions for violations up to and including termination. and anything significant or malicious can actually result in criminal or civil penalties for directly violating people's privacy. Please apply everything you've learned here constantly to help us protect our participants, their data, and the 9Health brand. Thank you for your participation. This concludes our training.